Ghana's main case management center for the COVID-19 virus says it has not had any supply from the National Water Company for close to a year. The hospital explains it is as a result having to spend more than 3,000 Ghana cedis every week to buy water into its reservoirs. This, they say, does not bode well for the critical role it has to play in keeping the deadly coronavirus out of Ghana. PSA Nanaya Safo has more in the following report.
Imagine going a day without water, none to drink, have a bath, or prepare meals with. It is truly an unhealthy outcome, even worse when the facility in question is a hospital, where the utility is needed to clean wounds, mop floors of wards, and to keep surgical instruments free of infection.
Yeah, it's not flowing.
Tremantin Benson is administrative manager at the Tema General Hospital.
These challenges for the past 1 year.
TGH is the biggest health facility in the Tema metropolis with 24-hour specialist and general medical services. It was designated a coronavirus case management center last month. It might seem prepared for the global epidemic, yet an administrator there who prefers to remain anonymous opens up about its local water problems.
It's an issue because patients come, the washrooms needs to be closed because there is no water to flush. Most often the Ghana Water Company lines doesn't flow at all. And so the hospital made arrangement to get a backup. So we engage the private tankers and we spend not less than 3,000 cedis at least every week.
That is an estimated 150,000 cedis of the hospital's revenue spent on water each year, even though it is supposed to be supplied by the Ghana Water Company. The administrator, however, insists this should not affect the hospital's preparedness to contain coronavirus cases brought there.
Maybe the fact that Ghana Water is not supplying water, we have nothing to do. We have the Veronica bucket, like I said, where we store water so that in case there is any need for you to wash your hands, that can be a backup plan. And then also we have the alcohol hand wash, which also we have put in place to ensure there is thorough hand washing.
Is it adequate?
Of course it is.
Staff and families of patients who spoke with JoyNews, however, disagree with the hospital management. They describe the situation as unbearable and have called for authorities to immediately intervene.
In the OPD here, you know, we have one of the commercial blue washrooms here. So like when there isn't enough water flowing or water is not flowing, you know this awful smell, yes. It comes to the whole OPD, which is not appealing. So we'll plead to the government and then the health sector if they can aid the facility in implementing most of our water issues. And then most of the patients, you know, they tend to develop this body odor when there isn't enough water or shortage of water.
It is embarrassing for a hospital of this repute to continuously be in this situation, she says. There is no water available most times. You can only imagine the blood and state of the mothers who deliver here. We are calling on authorities to act immediately. Water is so hard to get sometimes. We have to search and search till we reach our only option, sometimes a mortuary facility close by.
This
The Ghana Water Company in Tema could not be reached for comment, even though they conceded they are aware of the challenge. Meanwhile, patients and their families are having to bring in their own water to complement hospital efforts. PSA Nanaya Safo, JoyNews.